Hello, class. This is your first quiz review covering chapters 1, 8, and 11. Understanding oneself sexually and having interpersonal skills and integrity are two characteristics of sexual intelligence. Other aspects of sexual intelligence involve scientific knowledge and consideration of the cultural context of sexuality. Our Sexuality, which is the required text, takes a blank approach, reflecting the author's view that psychological factors and social conditioning have a crucial impact on sexual attitudes, values, and behaviors. We're looking for psychosocial. So just to recap, the psychological factors are emotions, attitudes, and motivations. And the social conditioning is the process by which we learn our social groups, expectations, and norms. In China, blank actively promoted sexual activity, including oral sex, sensual touching, and intercourse as a way towards spiritual growth and harmony in addition to procreation. We're talking about Taoism. The sexual connection of a man and woman during intercourse was believed to join opposing energies, yin representing female and yang representing male, thereby balancing the essence of the two energies individually. To conserve yang, men were encouraged to ejaculate infrequently, and for females, orgasms were pursued. Okay. In China, just give you the answer there, around 2500 before Christ era, the earliest known sex manuals were called Kama Sutra. Okay, that's when they were discovered. According to some researchers, philosopher Vatsyayana wrote the Kama Sutra, which consists of 7 books focusing on love, pleasure, relationships, and life. Contrary to beliefs, the book series dedicates only 1 chapter to sexual techniques and positions. Even though it contains quite a few, only 1 chapter is devoted to that. Calling a woman a slut to humiliate, intimidate, and degrade her for sexual behaviors that cross the line of acceptable sexual activity is termed slut shaming. Both sexes engage in slut shaming. Slut shaming occurs to express contempt towards a woman or exempt women from being targeted. They exempt themselves from being targeted. Okay. All right. The Madonna whore complex describes a man's inability to maintain sexual arousal within committed, loving relationships. Women's sexuality was polarized between the 2 images that you see here. The first is a Marilyn Monroe-like image, which would be Eve. She would be the evil temptress. The other image is an image of a Madonna or a virgin. And and the two images together evolved into the vernacular of Madonna Horror Complex. You might also see it referred to as MWC. Research about the sexuality of women during the blank blank found that the majority experienced sexual desire and orgasm. The fashion that you see in this image represents the Victorian era. Celia Mosher conducted the only known research on female sexuality during the Victorian era. Over 30 years, she surveyed 47 married women through questionnaires. The dominant image of Black womanhood is referred to as a Jezebel. Slaves were viewed as sexual objects, and that imagery carried over into life post-slavery. Women were known as Jezebels, and men were called bucks. The euphemism Jezebel describes a treacherous seductress with an insatiable sexual appetite. Her male equivalent was also highly sexual, potentially violent, and that was called a buck. Slaves had no right over their bodies, nor had agency over how they were viewed, which greatly influenced or even justified poor treatment by whites. In complete blank, a person neither masturbates nor has sexual contact with another person. In partial blank, an individual masturbates but does not have interpersonal sexual contact. We're talking about celibacy. Many women, English women specifically, chose celibacy for the following reasons: to be free of the limitations imposed by marriage and motherhood, to enable them to enter a religious community to pursue an education, and to enable her to retain her political power. Because if that woman married, they would have been subject to her husband's will. Okay. Involuntary orgasm during sleep describes nocturnal orgasm. Both sexes experience nocturnal orgasms. A man's ejaculation is evidence that a wet dream, which is another term for a nocturnal orgasm, has occurred. However, the evidence isn't as quickly determined for women because sometimes fluid does maybe not ejaculate, but seep from the body, and sometimes it doesn't, or it's just a small amount. Okay. Stimulation of one's genitals to create sexual pleasure is known as autoeroticism. Autoeroticism is another term for masturbation. Alfred Freud's view of masturbation is that masturbation is normal during childhood, but if it's continued into adulthood, it could result in the inability to form good sexual relationships. Remember that. According to the blank, 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 if someone is sexually active and has a sexually transmitted infection, but chooses not to inform their sexual partner for fear of rejection, they would be demonstrating a lack of respect and responsibility towards oneself and their partner, which is also described as level -1. We're referring to Malt's hierarchy of sexual interaction. According to Malt's hierarchy, sexual energy is a neutral force, so meaning ground zero, that influences sexual behavior either positively, which he identifies as levels 1, 2, or 3, or negatively, which are described as levels -1, -2, and -3. Doing this with a closed mouth tends to be more tender and affectionate. We're simply talking about kissing. On the other hand, open mouth, deep or French kissing is usually more intense and generates more sexual feelings. The Kama Sutra's manual has 17 different kisses that it describes. They're very, very interesting, and I should have posted a copy of that in Canvas, so you can review that, but it's very, very interesting. Oral stimulation of the vulva is cunnilingus. Oral stimulation of the vulva, the clitoris, labia minora, the smaller set of lips that hang, the vestibule, and the vaginal opening all would be considered cunnilingus. For your quiz, however, I want you to remember that it's oral stimulation of the vulva and all the structures that go along with that. Oral stimulation of the penis is termed fellatio. Fellatio involves stimulation of the glands or the head of the penis, the frenulum, the shaft of the penis, as well as the scrotum, all of which would be considered fellatio. If heterosexual couples are planning to have vaginal intercourse as well as blank blank, it is suggested to do it before having blank blank. We're talking about anal intercourse. In blank blank, the man learns to control and delay his orgasm and redirect the sexual energy throughout his and his partner's body. The couple also harmonizes their breathing. We are referring to tantric sex. Tantra began in India around 5000 before Christ era, or BCE, and was an ancient Eastern path of spiritual enlightenment. The image on the left shows a damaged or enlarged vein in the testes or the vas deferens. This damage is called varicocele. The varicocele causes blood to pool in the scrotum, elevating the area's temperature, thus impairing sperm production. When this occurs, men must go to the doctor to have that checked. A medical procedure, just popped up there, in which semen is placed in a woman's vagina, cervix, or uterus manually. That would be artificial insemination. So, to describe a little bit more about that, semen, of course, is introduced into a woman's vagina when it's done so directly, it's referred to as intrauterine insemination. And the purpose of doing that, of course, is to facilitate conception. Artificial insemination can be achieved through a donor's sperm or from one's partner's sperm. In instances, male donors offer to have sex at no cost, which is called natural insemination. So you could either buy the sperm and have it entered into the uterus manually, or you could offer to have sex with the donor and do it that way. Someone you may know, their name is Thomas Beatty. He's known as the pregnant man. And that person is well known for opting for artificial insemination to give birth 3 different times. Now, Thomas Beatty was is a woman biologically who transitioned to a male. So he was a F to M, and he kept his uterus. So that's the reason why he was able to facilitate getting pregnant and giving birth 3 different times. So Thomas Beatty is not a male biologically. Okay, moving on. A hormone that is detectable in the urine of a pregnant woman within 1 month of conception. That is human chorionic gonadotropins, also referred to as HCG. HCG is a hormone that's secreted by the placenta of the unborn that indicates a woman is pregnant. HCG tests conducted in a doctor's office can detect pregnancy as early as 7 days after conception. In comparison with at-home tests, it can detect pregnancy, but it takes a little bit longer for that evidence to show. So it's like maybe 1 week after your missed period, an at-home test would show truer results. Okay. This court decision legalized a woman's right to terminate her pregnancy before the fetus can survive, independent of that woman's body. And I have the answer right in the image. It is Roe versus Wade. Yes, so in 1973, the U.S. Supreme Court codified Roe versus Wade. In 1977, the U.S. Congress passed the Hyde Amendment, which restricted the use of federal Medicaid funds for abortion, leaving many low-income women without this resource. And then in 2022, the Supreme Court overturned Roe versus Wade, essentially ending a woman's right to abortion. And that is being argued at the state level continuously. This is one of the longest and most controversial debates the US has ever had. Okay. A syndrome in infants caused by heavy maternal prenatal alcohol use. And the characteristics of this syndrome are congenital heart defects, damage to the brain and the nervous system, numerous physical malformations, such as a small head, low nasal bridge, a flat mid face, underdeveloped jaw, a thin upper lip, small eye openings, a short nose, and below normal IQ. We're talking about fetal alcohol syndrome. It's difficult to determine a safe level of alcohol consumption that would not pose a danger to a developing fetus. So the first trimester is the most important trimester in a woman's pregnancy. That would be the first 3 months. So as soon as she knows that she is pregnant, which she may not know right away, but as soon as she knows, up until at least 3 months, you want to avoid alcohol at all costs. Fetal alcohol syndrome can lead to intrauterine death. It can also lead to spontaneous abortions, premature birth. Yeah, so alcohol is definitely a no-no during a pregnancy. All right. The first stage of labor and delivery is the thinning and opening of the cervix, called effacement and dilation. The second stage is when the baby is born. I want you to make note of that. During the second stage of labor, the child is born. The first stage takes anywhere from, it could be an hour, it can be 3 days. It really just depends, but a woman is trying to dilate to 10 centimeters, which gives enough room for the child to be born. And the third stage of labor is the delivery of the placenta. All right. It's all three stages would be considered labor and delivery. All right. Yep. That's all I want you to know about that. Symptoms of depression and possibly obsessive thoughts of hurting the baby is postpartum depression. At its most extreme, postpartum depression can cause women to lose interest in their babies and develop obsessive thoughts about harming themselves and their babies. I worked for many years in with pregnant women, and some of the symptoms that she may, or experiences that she may have after giving birth, just run the gamut. Postpartum depression is one of the more extreme situations. Um, but women can also experience what's called the baby blues. If she's experiencing the baby blues, she can still call and talk to someone, to feel better, to understand that she's not alone, and this process is difficult for everyone, every mom. It's difficult for dads as well. So um, don't be afraid to talk to someone, because you don't want to be down. You want to be happy about your baby, even if it is a difficult time for you, and do what you can to give it your best. Okay. The extra credit question. Your quiz will be 25 multiple choice questions. Each of those questions are worth 4 points, but your extra credit question is worth 7 points. So I want you to definitely prepare for that. I want you to make sure that you watch the TED Talk video that is in Canvas titled My Mother's Strange Definition of Empowerment. Your question will come from that video. I wish you all luck. And I will be online while you are taking your quiz, periodically over the 2 days. And if you have any questions, I will be in my office next week as well.